Now, Good Party Secretary General Brett Herron has made an impassioned plea to South Africans not to let their guards down, regardless of economic standing and political affiliation. In an opinion piece, Herron warns the nation of the dangers of not wearing masks and cautions people not to gather in enclosed spaces. Herron contracted COVID-19 now 3 weeks ago and is about to get out of quarantine. In fact, he joins us now live on the show to share his journey with COVID-19. Brett, it is great to see you this morning. How are you doing?
Good morning. I am doing a lot better than I was 2 or 3 weeks ago, but I can still feel that I have been infected. But I'm now out of isolation or quarantine and trying to ease back into work and into life.
You know, I was just reading through the column that you wrote, and one thing really stands out for me in what you had to say. You know, we can all recite the defense mantra: social distancing, hand washing, mask wearing. It feels as if we are intimately acquainted with this beast, but logic goes out of the window the moment you start struggling to breathe. Tell us about your experience. Take us back to that moment when you got your positive test.
So, I wrote the piece because I think we all have been dealing with COVID-19 for 18 months. We've heard a lot about it. We've heard that the country has spent a lot of money on communications. But the moment that you get it, I realized that I actually knew very little about what was going to happen to me. And I couldn't even find a place to be tested. And I serve on the Western Cape Provincial Parliament's COVID-19 ad hoc committee. I've accessed a lot of information. And when I woke up 3 Sunday mornings ago with severe flu-like symptoms, but they were not exactly like you would experience flu. I had extreme pain in all my joints, and a very, very cold fever where I couldn't warm up. And when I looked to find a place to be tested on Google, there was just nothing that came up that was helpful to me in terms of a location that was nearby to my home where I could go and get a test on a Sunday morning. So I had to call a nurse out to my house. It was a very expensive process that not many people would be able to do. So that was my first realization that we've been talking about it a lot, but we don't really know much about it. And in the first 5 days after the COVID was detected, they say detected on the test and not positive. So I was tested and detected with COVID. The symptoms were unpredictable. I slept a lot. I was extremely fatigued with this fever that wouldn't go away, a headache. And my GP, when I called him and told him that I'd been tested positive, said to call him immediately if I was feeling out of breath or coughing. And about 5 days in the evening, I started feeling out of breath. I'm still a little bit breathless. I then called the GP. It's the first time in my life I've called a doctor after hours, and asked him, he said I needed to get a prescription that he would call through to an after-hours pharmacy. I asked him if it could wait till the next morning, and he said absolutely not. I had to do it then, and so that started the breathing journey, which was quite a difficult experience and a scary experience that lasted for about 5 days.
Yeah. I mean, what does that say to us? You know, you talk about the fact that you are relatively healthy, you've never smoked. You talk about your middle-class existence and what that means for your access to the kind of healthcare that you've just described. You know, what are we to read into the province's own response when you couldn't find a place to get tested as Brett Herron, as someone who sits on a committee in the Western Cape dealing with COVID-19?
I think there's 2 things that come to mind. First of all, communication is useless unless actually it's readily available. So the manner in which we're communicating about when to get tested and where to get tested needs to change. I could pick up my phone and Google, and I think there's quite a lot of cell phone and smartphone penetration in South Africa. And so I would imagine that many people in different socioeconomic circumstances would also turn to the internet to try and find what to do next. And the fact that communications experts have not made it, have not put money behind listing where to get tested in Google, for example, at the top of the list, is a failure, I think, in how we're communicating. And secondly, the disparities. I could access a call-out service, which has, as I said, was very expensive. I can't imagine what it must be like to be someone who is experiencing those symptoms, would have to get up, get dressed, get out of the house, find a place to be tested, sit and wait to be tested, and then still trying to access the medication when it was needed. I can't imagine what that must be like for people who don't have access like I have.
Yeah. And what you've just described there, with the kind of symptoms that you had at the time, to get up, get dressed, and for the vast majority of South Africans, and that's very true for the Western Cape as well, not get in your car, most likely find another way to get to a testing center, whichever way that is.
Yeah, absolutely. Right at the beginning of COVID, when there was the hard lockdown in April, May last year, I was helping organizations deliver food into the Cape Flats and into townships in Cape Town area. And despite COVID, people still had to get into taxis or walk or stand in long queues at supermarkets because life is very different, as we know, in different parts of our country where inequalities and poverty is deep. So it's about, I can't imagine what it must be like to live, say, for example, in an informal settlement, to wake up with these symptoms, to try and find where to be tested, to get there, and then to go back to your dwelling, which is probably 1 or 2 rooms, and try and isolate and recuperate in those circumstances. This experience for me just heightened my awareness of the health access inequalities that exist in South Africa and in the world.
I mean, Brett, what do we do with this kind of information now? I mean, what you've just described and what you know about how our government has managed the pandemic so far, insofar as access to testing, the ability to self-isolate, access to the right kind of medication outside of being hospitalized, are we handling this pandemic in a way that saves the lives of the people you've just described, for example, people living in informal settlements?
Well, I think that my experience has made me very aware, and it's the issue, something that I'll be raising in our COVID-19 committee and publicly, that we're paying a lot of money for communications, but the communications is really ineffective. If someone like me can't figure out what to do the morning you wake up with the symptoms, and then access to the healthcare services is something that I think we need to focus on. That there's a huge inequality in access, and with these symptoms, it's not easy just to get up and go to the local clinic. So we need to look at how we improve access to healthcare. And then I think the third thing that we need to focus on as a country and as political leaders is access to the vaccine. It is, I think now, it is a human right to have access to the vaccine, and that we are struggling in South Africa to obtain a sustainable supply of vaccines, and it's not only South Africa, it's many countries around the world, puts at the top of the world agenda, or should put at the top of the world agenda, this patent waiver that South Africa and India have proposed to the World Trade Organization, that there needs to be an abundant supply of vaccines across the world, and nobody should be denied the right or the access to a vaccine because of the wealth or lack of wealth of the country.
Yeah, absolutely. Just a final question on your recovery, Brett. You say you're still quite breathless even as you're speaking to us now. You know, my co-anchor Ayanda and I have been talking about the mind aspect of getting through a COVID-19 positive test. And even in your opinion piece, you talk about the dread of the possibility of being hooked up to a ventilator. You know, how much of trying to keep your mind right was part of your recovery?
I think it's a very, very stressful experience because, I mean, we follow the infections and most of us follow the death rate, this kind of morbid fascination with mortality. So when you get the symptoms and the symptoms start to worsen and you get to that point of breathlessness, and I can still feel, as I'm speaking to you now, breathless, it's very difficult to imagine what's next. But of course, what is in your head is that there's the possibility you're going to end up in hospital and die, or even die on the way to a hospital. There were moments when I thought that I was never going to be able to get any air to take my next breath. And in fact, my doctor, when I called him, when he called me the next day after he had prescribed the steroids to ease the breathing, and he was quite blunt with me. He said, "You're going to feel better some days, you're going to feel terrible the next day." But he said to me, "But I can tell you that you could still die." I mean, he actually used those words to me. And so to keep a positive mindset and to push through is very difficult when your doctor says straight out to you that you may still die.
Sure. Well, we wish you all the very best with the rest of your recovery, Brett. It's great to see you, coming out on the other side of COVID-19. Brett Herron is the Secretary General of the Good Party and a member of the Western Cape Provincial Legislature, recovering there from COVID-19. It's so, you and I were talking about this off air, the mind aspect of COVID-19, a doctor telling Brett Herron there, you may feel better, you may feel worse, you may still die. Yeah. From COVID-19.
Really sobering to hear that. But two things really stand out for me. One of them is a point that's been well made already. What is really difficult about COVID is that it's an isolation battle. You have to fight this virus, which can be very vicious on your own, which is not what we're used to as humans. Yeah. In many instances, you used to be cared for in close proximity by the ones you love, and that counts. Yeah. It's not scientific, but let's be honest, it counts. The other thing is what Brett mentioned. Even if you try to insulate yourself and keep a positive attitude, news around COVID is everywhere. If you're trying to catch up on what else is happening in the world, you're being met this morning by another record-breaking jump in the number of COVID-19 infections in a place like Gauteng. That must also mess with you, for lack of a better term.
Yeah, there's so much to take from that interview. For any of us who are suffering from pandemic fatigue, there's so much to take from that personal story of a COVID-19 infection. The other big issue that stands out is the access to healthcare that so many of the people living in our country don't have. When he was on the phone to his GP that night, and the GP saying, go to an emergency pharmacy and get this medication to help you breathe. How many people are unable to do that?
Yeah, and that's Brett Herron, right? Pretty senior politician in the Western Cape. He's had a lot of time also in the DA before moving to the Good Party. If he's having that problem, I shudder at the thought of the kind of difficulties that other people are having, not only in the Western Cape, let's be frank, certainly around the rest of the country.